FACP, Fellow of American College of Physicians. Recently, I was asked by one of my colleagues that how to get this title, FACP. And as you may already know, Fellow of American College of Physicians, this is a quite honorable credential because it shows that you are peer reviewed, your CV has been judged, and then you got this title. Full disclosure, I'm making this video because along with my colleague, couple of other early career physicians, they reach out to me about my advice how to get FACP, to get some guidance. I do not have any financial relationship with American College of Physicians. So in this video, I will share with you my experience and my tips that how you can prepare your application to get FACP. So first, why FACP? Because as I already mentioned, this is peer reviewed. This is a title after your name. Your application has been reviewed by multiple people, and it is giving their approvement, the American College of Physicians acknowledgement that, okay, you went above and beyond to achieve this designation. So before we deep dive, what are the advice to get FACP? If you are new to this channel, welcome. My name is Dr. Farzana Hoque. I'm an associate professor of medicine, currently practicing in the US. A couple of years ago, I received my designation FACP. So let's first deep dive. What are the requirements for FACP? Because I believe, that is very important for us to know first. As you can see in this screen, that at least you must have to have 3 years from your post-residency training. And also, you need to be board certified either in internal medicine or neurology, as you can see, and good medical license in clinical practice. It could be inpatient versus outpatient. So now let's focus on what are they telling. They're telling among these four, three of these pillarship you need to fulfill. So what are these? As you see, one is continuous medical education, then is community and engagement and service. After that, practice involvement or scholarly activity. And lastly, teaching, coaching, mentoring, and leadership. If you are already working, either inpatient in the hospital or in the clinic, you can, highlight many of these. First, what about continuous medical education? When you are keeping your license, you have to go to grand round, different conferences. So you are earning all those CME educational credit. So you can show that. Then next is I will highlight a scholarly activity or practice improvement. A scholarly activity, as the name sound, if you have been invited to give any talk in a conference, or if you have been invited to give a talk in any organization, maybe this is your organization, that you can include. Maybe you have been invited to give a short lecture to residents or medical students or to your colleague. You can always highlight that. What about practice improvement? Maybe you are part of the committee, such as I'm chair of the patient experience committee. So if you are part of a committee, you can highlight that, and that could be under this practice improvement. What about teaching, coaching, mentoring? If you are like me in a academic medical center, you are already teaching and mentoring medical students, residents. Maybe you are in a clinic and, couple of years, you get medical student to shadow you. And, this teaching, mentoring, it could be beyond medical students and residents, such as maybe nurse practitioner, physician assistant, nurses, they are shadowing you. You are mentoring them. That you can also involve. If you are mentoring any early career physician, you can also include that. Now let's talk about leadership. If you are in a committee, maybe, if you are chair or director, you can mention. If you have any leadership opportunity, it could be volunteer as well, as long as it show that, okay, you are leading any committee, any organization, any small group, that you can highlight under this leadership. Now let's talk about the last part, what they're asking for: community service and engagement. If you are working in a free clinic, that you can mention as a community engagement. If you are going to a school, maybe few times a year, to educate the school children about the medicine, about healthcare, that can also count as community engagement. So, at the end of the day, if you fulfill three of these four pillars of fellowship, you will be good to go. Now let's focus on what is the CV format. So before I show you the CV, as you see, you have to complete this application form, and then there is $175 sponsor fee. And then you have to contact a colleague who could be fellow of American College of Physician or master of American College of Physician to sponsor you. Let's now focus on the CV. So I believe, here you are seeing a great example of the CV that you can utilize easily to build your CV. I believe, they made these things easy so that you can also create your own CV. I hope you find this video helpful. And if you have any questions or any input about your journey for FACP or Fellow of American College of Physicians, please let me know. I hope you will subscribe to this channel, because your subscription means a lot and it keeps me motivated to make more educational videos for you. And here in this channel, we are aiming for 5,000 subscribers. So please help us to achieve that goal. I will see you in the next video and wish you all the best. Take care.